Thank you for that introduction, Mr. Ward. My name is Wardy Ward, and I'm your tour guide on this important episode of What's Up with Ward, the podcast. I'm from the good hood where we get it and give it good. Our motto is everybody has a story to tell. We just want to know what's yours. With that being said, our in-studio guest today certainly fits this criteria, not only because she helping the vulnerable populations who needs healthcare in Indiana with her particular skill set, she also has an extraordinary background that I'm sure it's going to amaze you and everyone involved. So, ladies and gentlemen, please join me in welcoming Miss Rachel Maxey to the lab. How are you doing today, ma'am?
I'm doing good, Ward. How are you?
I'm doing just delicious in my own words. So, Rachel, before we get started, can you tell the listening audience a little bit about who Rachel is?
Well, I am from Indianapolis, Indiana, born and raised. I grew up on the
Mhm.
northwest side, so Pike Township area, Pike High School
Okay.
graduate. Um, I currently been working at MD Wise, which is one of the Medicaid healthcare companies here in Indiana for it's been 12 years, over
Hmm.
10 years. It's been a while.
Okay. Yes. Yes.
Yep,
Okay.
and
Awesome.
glad to be here.
Yeah. So obviously you're an expert in this area. What type of or what positions have you held at NDYs over those 12 years, 10 to 12 years?
Well, I started out as a customer service rep, so I was just answering the phone, member calls, provider calls, and doing health needs assessments and things like that. And
Hmm.
then at little about when the marketplace came around, we actually had a marketplace plan, and MDYs offered everyone the opportunity to get their license, and they paid for it. So I got my
Yeah.
license and helped out in outreach, which is how we met. And
Yep.
when there's a position open, I applied and I've been in outreach ever since.
And still together. All right. That's what's up.
Yeah.
So now the name of your company again, you says MDYs. I see it on
Yeah.
your shirt there. Okay.
MDYs, yes.
Okay. Now, do people call that something else, or has this always been
You
MDY?
may hear MedWise, but it's
Yeah.
MDY. It's officially MDY.
Okay. Okay. Got it. Glad that cleared that up. Now, are you, is MDYs new to the insurance arena?
Oh no, we've been around over 20 years. We've been around since 1994 and specifically doing programs for the children's health insurance. So Healthy Indiana Plan. I'm sorry, Who's Your Health Wise children covers children 0 to 18. And then also we do the HIP program or Healthy Indiana Plan for adults 19 to 64.
Okay.
And
I
then
may
we,
ask you about that again, may go a little deeper in that because I might have some questions on that. So thank you for bringing that up. Now, again, what is Medicaid and who pays for this Medicaid?
well, Medicaid is a state run federal program where it
Yeah.
offers or individuals who are low income, uninsured, underinsured, the opportunity
Hmm.
for based on their income to have health insurance. And it's in again income based. So when someone applies, they have to answer and provide information so that their eligibility to be on Medicaid can be determined. And then there's different programs, Medicaid programs. So there's again, Who's Your Health Wise for children, or for
Hmm.
adults is the Healthy Indiana Plan, and that's here in Indiana. It differs around the country, but the type of Medicaid programs they have, but specifically here in Indiana, it could be Who's Your Care Connect, which is for age blind disabled, or
Hmm.
um, traditional Medicaid. So just depending on that individual circumstances, and it will determine what they qualify for, which Medicaid program they qualify for.
I see. So again, it's that no, health, what was it for the 19 and under? It's called who?
Health for the 19 to 64, it's Healthy Indiana Plan or HIP program.
And the young people, that one, what that, the name is?
For the 0 to 18 is the Who's Your Health Wise program.
Okay, the Hoosier Health Wise program. So what does that cover for the people on the Hoosier Health Wise? Or
It
is it the same
covers
across all plans?
Yeah, it covers medical, dental, and vision for children. So, of course, we want our kids to get in and get their vaccinations and well child checkups, and be
Hmm.
able to go to the doctor when they're sick and not have to. go to the ER. So it covers all wellness visits for kids. Dental visits are very important. So going in, getting those 6-month checkups, yearly checkups on your teeth is part of your health. So the Hoosier HealthWise program covers pretty much all kids' healthcare needs that they.
Okay. Yeah, nice. So does that matter if their parents are making too much money, or I mean, so my kid can get it no matter what?
Again, it's based on income. So there is a certain income level that a parent would have to be within to qualify for Medicaid. And
Mhm.
going to a certified navigator or healthcare centers usually have financial counselors that can help talk an individual through the application process, let them know what the eligibility requirements are, and then from there help them sign up and get the best coverage that fits for them. So again,
Okay.
it's all based on your eligibility factors like
Yes.
income, household size, those type of things.
Okay. So if a young person under the age of, say, 17-year-old, he's living by himself, it's just going to go by his income then, or you
For
want to get
that,
the,
that's a that's kind of a tricky situation because that child is technically not 18 yet. So again, when it comes to healthcare, working with a navigator, they'll be able to advise and help that individual um, get signed up. So whether that is if that 17-year-old is emancipated, they may have that paperwork where they can do that on their own, or they may have to find a guardian. I'm not 100% sure, but a
got it.
certified navigator will be able to help assist with getting that child coverage if they are in that type of situation.
Okay. Now I've heard that term navigator before. What's the
Mhm.
difference between a navigator and what's the other one after the navigator? Not navigator, I
Financial
guess an
counsel
agent. Yeah,
or
okay. Financial counselor, navigator. Yeah,
insurance
yeah,
agent.
agents. Do they do the same thing, or do they do different things?
It depends. Some to sign up for Medicaid, that individual has to be take a training class and pass to get
Mhm.
certified to sign people up. So just kind of like insurance producer or insurance agent, you have to go
Yeah.
through a training to be able to help people initially sign up for health coverage so you can understand what Medicaid is and know all the
Hmm.
different plans and income guidelines and information, eligibility information that's needed to provide that
Yeah.
person assistance with signing up.
I take it that test is challenging.
I
To,
haven't taken it. Yeah, I have taken the Indiana producer's license. That is very challenging. I know I've heard stories of people who've taken it 20, 30 times before they passed
oh,
it.
mm,
Luckily, I it only took me twice to pass it.
okay.
Yeah, it's very intense test, and once you pass it though, it's I even though I don't use it right now because we're not in the marketplace, but I still
Yeah,
keep up on my continuing education classes and pay my
right,
licensing fee every 2 years so I can keep it because I work too hard,
right.
as
You
you
don't want
know,
to,
to
yeah.
pass that test. So just to let it fall off would be just not
Hmm.
a good thing.
Yeah, nobody's trying to take that test twice.
Yeah.
That Healthy Indiana plan, I heard you say that's 19 to 64, right?
Hmm. Yep.
So what happens go ahead, sorry.
Yep. Age 1964.
So what happens when the person is coming off the Hoosier Health Wise, and he's his age is increasing. Now he's going to the Healthy Indiana plan.
Hmm.
Does he still fall under his parents' insurance at this time, or does it become his own
It
policy?
will be his own health insurance. So once he transitions from Hoosier Health Wise onto HIP, it'll be on him. It wouldn't be based on his parents' income,
Mm,
or if they were had if the parent had private insurance, he's not like covered under them. It's his own ins- insurance in his name.
yeah. Okay. All right. That I was wondering about that. And also, I saw on your website. I'm not sure if you're in this area or not, but they had something called Medicare Advantage. Is that something that you guys work with as well?
Yep, that we do have a Medicare Advantage plan. Now that's not my area, but definitely if someone was interested, we have our contact information. They can call and speak to a local agent that'll be able to provide more information on our different plan options and what those entail.
Hmm. Now, you guys only work with people in Indiana, is that correct?
Yes, we are Indiana based and we only cover Indiana. So we don't cover, I know some insurance companies cover in different states. We only cover Medicaid here in Indiana in Medicare.
Hmm. About how many members do you guys work with?
Currently right now we have over 400,000 members.
Ooh,
Yeah.
wow, that's a
And that,
lot.
yeah, that's with our Medicaid population or Hoosier Health Wise and our HIP members. But
Hmm.
specifically coming up, that could change not just for us, but across the board with calling it return to normal or the ending of the public health emergency. Things are going back to normal. So redetermination is going to come back up for a lot of people where they're going to have to um, provide information to the state to make sure that they're still eligible to keep their coverage. During the
Hmm.
pandemic, as we know, individuals were able to get signed up and um, no one was kicked off if they, you know, lost a job, got on HIP, and then got a job and um, making more money. Well, technically, they
What?
would or they would have not qualified, but since it was the public health emergency, no one was kicked off. Well, now starting April 1st, everything's going back to normal. So redetermination
Ooh.
is coming back up. So people are going to have to start verifying their income and contact information to make sure they're eligible so they can keep their coverage. So a big
Mm.
campaign right now is for people to check your coverage, meaning right now, making sure your information's up to date with the state, making sure they have the correct address, the correct phone number. So when those notifications, when your redetermination is up, and we're sending out the information to you, you don't miss it because it's gone to, an old address and
Hmm.
we don't have the excuse me, the new information, and you may miss that opportunity to keep your coverage.
Mm.
So
Yeah.
the
I, I asked that because I do some work in a methadone clinic here in Indianapolis. I know a lot of people were talking about that, maybe their coverage ending and what are they going to do. So you're saying before they kind of had a good situation, they wasn't kicked off. It was just like you got it, you good. How
Mhm.
long did they have that good run? Was that three
It's
years?
been going since, yeah, the pandemic, which started in what, 2020, and they
Yeah,
just
yeah.
recently in the last 2022 is when we really started getting back open.
Mm-hmm.
I don't have the exact date, but like the some with funds that provided extra money for the states to help with COVID and things. That part is ending, so that's what's causing everything to revert back to normal or return to
Mm-hmm.
normal, if you will.
Yes. So a hypothetical question is, let's say at that methadone clinic, these people don't necessarily follow the rules and go back and get everything updated and turned in. Would they lose coverage?
They could lose coverage. So if um, they're in that bucket where they don't respond at all and their coverage ends, let's say May 1st, they still
Mm-hmm.
have 90 days, I believe, to provide whatever information that was being asked. So if they just need to verify income or need to verify their address, if they submit that information and they're deemed qualified still and deemed eligible, they can get their coverage back. So, but the goal is to get that information submitted before they're even kicked off, because
Yeah.
once they get coverage, that if they, especially if they're getting procedures or doctor visits coming up and things that may interrupt their care. So to avoid
Mm-hmm.
that, just be on the lookout for mailings from FSSA, because your redetermination letter, that's going to tell you exactly what they need, and just get that submitted. And there are different places you can go to get help. So say you don't have a scanner or ability to fax, you can go to places like Covering Kids and Families, which is located right off of 38th Street. They are a group of navigators that can help with submitting
Mm.
documentation or updating information or helping you get it logged into the FSSA benefits portal, where you can actually, if individuals create their portal account, which is their Medicaid portal account on FSSA's portal, they can upload or scan their documents right into their file and don't have to worry about mailing or any of that type of stuff. So that's
Wow.
one of the
Yeah.
things we're encouraging is for individuals to look in, create their FSSA member benefits portal so they can
Yeah.
see maybe if they did move and they just um, updated their address, but their redetermination paperwork already mailed out. Well, they'll be able to see that information in their portal account. That's the cool thing
Mm.
about it too. So anyone, if they create that member portal account, they can check their benefits and know what letters they missed if they did move.
Oh yeah. Yeah, that's cool. So is that portal, is that pretty user friendly? Because I know sometimes people are
Mhm.
hesitant to use these I guess modern
Mhm.
technology because
Yeah,
whatever
it is.
reason.
Yeah, right. And it is user friendly. But again, if somebody's not comfortable or not used to using, creating their own portals or knowing how to navigate through a website, there is again help available that people who are able to assist with helping them get their portal account created. And
Yeah.
also too, MDYs and all the MCEs, Anthem, MHS, Care Source, we're all doing activities around the state to get the word out and make sure our members get the help that they need to make sure they keep their coverage. So like for
Mhm.
MDYs, we do our back on track events, but also on top of that, we're doing check your coverage events. So we'll have like our iPads at the event where individuals, if they don't have internet or don't have a laptop or a device to use to create a portal or whatnot, they could come to our event and be able to get that type of things done and get help or get questions answered if they have them.
Yeah. And I'm sure you guys give some goodies away at these events as well.
Of course, we have, the trinkets, the water bottles, and hand sanitizers. And recently we got tumblers and mugs and earbuds and, all that.
What? Wow. Y'all doing nice.
But
Okay.
with the cords, they're not the wireless ones.
Hey, that's cool. Free is free.
Right.
Yeah.
And then for
That's
kids, jump
good.
ropes and coloring books and things. But yeah, we give goodies away. We'll do raffles. When we partner, like we just had an event in Gary on back in February on the 25th, and we partnered with Edgewater and St. Timothy Church, and we had a back on track event where we offered COVID vaccinations, flu
Hmm.
shots, kid vaccinations. We have vendors there. We had
Okay.
legal service there. Gary Literacy Coalition there, where they gave away free books, new books, and there was since of course it was Black History, so they were Black History themed, so that was cool.
Yeah.
We
Wow.
had Covering Kids and Families there. Also, the church, we provided a presentation, so everybody that came through, they had to sit through a presentation where they listened to like mini quick speeches from
Oh
a
yeah.
doctor. We had a doctor and different vendors speak about their services and things that they can offer. And then I did my little spiel about checking
Did
your
your
coverage.
thing.
And then as
Yeah.
they exited, they all got a $25 grocery card. So offered that. So
What?
we trying to do our part too to offer those services. So those um, opportunities, if you're not able to go into the doctor to get your child vaccinations done,
Hmm.
we're offering that opportunity to get that done, and as well as other services that are available for you in your community.
That's quite a bit. You guys do this all over the state of Indiana.
Yep, we cover the whole state. So last year when we kicked off the back on track, which every coming out of the pandemic, the goal was to get all kids caught back up on their vaccine. So that was the basis of us forming the Back on Track events. And so we
Okay.
partnered with local health departments or Indiana Immunization Coalition or Indiana Department of Health. They would come and help with vaccines, and just make a big community event about it.
Mm-hmm.
If we were having it outside, depending on the weather, if it allowed, we have bounce houses for kids and different activities going on. So that'll help draw them out, but also at the same time getting much needed healthcare services completed.
Yeah.
We went to South Bend and partnered with South Bend schools and participated in their parent expo that they had, which was really fun. And they had different vendors, and we had IDOH come in. They had, I believe it was Notre Dame. Last year was Notre Dame soccer team, I believe, helped with like kid activities, and it was a really good event. And we were able to help get kids caught back up on their vaccinations, and then the parents got to get in, is encouraging the parents to get involved with the parent PTO. And so
Yeah.
yeah, trying to do our part to get everyone healthy, but definitely want to make sure everybody understands, get your information up to date with the state if you haven't already, and make sure you take advantage of those community events that are going on. Especially they offer free services, not just the free trinkets and things, but the
Mm-hmm.
free
Yeah.
services that'll benefit you
Yeah.
in the end.
Well, it seems like you guys definitely care about your members if you're going to these great lengths to reach them. That's very impressive. And you go back to this $25 gift certificate. Everybody got that, or just random people got that?
For well, we do a drawing, so we do
Okay.
everybody that comes and gets vaccinated, they fill out we have a white slip and a blue slip, and we have the white slip, you get a raffle for $50 gift card actually
What?
for
Man.
MDY we provide for the event. But the $25 gift card, that was something the church we partnered with contributed for the event as well. But we
Jeez.
do a gift card. We were doing a $50 gift card. Everybody who gets vaccinated can enter for that raffle. We do a raffle every 30 minutes. So giving away, if it's a event from 10 to 2, 4-hour event, we do about 8 gift cards for the whole event. So and then also on top of that, for our members, they get an additional raffle entry. We do a laptop giveaway to our
Oh
members,
my.
and they have to be members though. But
Man, it's a lot of stuff.
yeah, we've given away some laptops to some students, our members, and they really happy. We hand
Mm-hmm.
delivered. I've delivered them, a lot of them myself, but
Wow.
we go to their house and deliver it to them as well. So
Man.
it, again, just it kind of like an award in a way
Mm-hmm.
for coming out and participating and getting what you needed done.
So you doing Publishers Clearinghouse deliveries. You showing up the door with the balloons and the laptop. Wow. Man, I need to get some MDYs on myself. Man, gee. That's a win-win. I can see how that gets people out, because if you go into all those things, is that effective? Are you getting the people coming them out and finding that stuff?
Yeah, and just making sure we get the word out to our partners specifically
Mm-hmm.
helps. We do direct invites to our members, mailings, and we do advertising and Facebook posting, social media advertising, things like that. But yeah, just, and it's not even just about our members; it's also about the community as well. So
Yes, yeah.
we've had,
That's that.
I think, good success with just getting people out and participating.
Yeah. I would definitely come to that, because it seems like you're covering everything: bounce houses, laptops, gift
Food
certificates.
trucks, yeah, we have food trucks. We try to partner with the food bank or food pantry in the area to give food boxes so they can like take food home with them after they leave. We A lot of our events, we've been able to give away fresh produce boxes. One event when we were in Scottsburg, or down south in Scottsburg, we
Yeah.
gave away milk and cheese along with like some produce. That was kind of cool.
Mm-hmm.
That was the first time we
Yeah.
actually got milk. So
Yeah.
yeah, try to also try to address all the social needs that some
Mm-hmm.
members may need. So again, when they walk away from the event, they feel like they got the resources that they need, or at least are getting pointed in the right direction.
Yeah. Well, what about when members call in? How is your customer service? So you guys doing good on that too then?
Oh
Because you're
yeah.
just setting up a nice picture here.
Yeah, oh yeah, definitely. Anytime anyone calls, they can always get a hold of a customer service rep. Also, if they have created their member portal account, they can use the member portal account to send a message over to customer service and someone will reach back out to them. When myself or my team is out in the community participating in events and things, community partners can send us questions or direction on if they need to know how to need information on anything or need help getting a member directed to a specific resource. So customer service, outreach. We also have our recently for our quality department just hired outreach reps, but they won't be the outreach reps that go out in the community. They're the outreach reps that actually be doing calls to members. And so that'll also an avenue we'll probably utilize to help, get our members the additional help that they need and make sure that they know if certain events are going on or
Wow, that's very impressive. But let me ask you this. What's your customer service satisfaction rating? That's what I'd like to know.
I haven't looked at it, but last time it's pretty high. It's like 95% satisfaction rate.
That's almost 100. So y'all killing the game.
We are. And I always hear when I do, that's one of the things I always hear or ask when you call, have you called? Do you have any questions or feedback? And they say, no, every time I call, I always get my question or needs met. So haven't heard any, you hear horror stories about when somebody calls customer service and they either can't get somebody or they're waiting on hold for a long time. But no, most of our members that I talked to and from the study, our last survey that we've had, is pretty high and good customer service ratings.
That's important to me. I like good customer service because I don't want to say anything bad about stores around here, but Walmart, I have to really get my mental right to go in there. So if I could call somebody like your company, I've had an issue, I want to get it resolved at 95% or higher. That's telling me I'm getting an A service, A plus, A average service. That's customer for life.
You may get that, you may have that question that the customer service rep or individual may not have the answer to, but we do strive ourselves too in making sure we apologize and get follow back up with you immediately to get the answer that you need. If we're not, we all work together to make sure our members' needs are met. So even if we don't have that answer at the time of the call, we're gonna follow back up with you with the answer or with the next step for you.
Yeah, that's good. Another question I wanted to pivot to was a lot of changes happened because of the COVID. We're seeing getting things back on track and so forth. Were people still responsible for paying co-pays during this time, or did that kind of?
Yeah, that it'll be turned back on, but as of right now, we haven't gotten word on when that will be. But as soon as we know, we'll definitely let the members know, and the state will let the members know. But that is going to be a component that will be turned back on. We just don't know when. So as of right now, individuals will just right now it's not per se a co-payment right now, but in the next few months or so, we should know like a definite date of when those cost sharing will turn back on.
How much was that? Is there a specific amount of the cost sharing or co-pays? Or
so for the HIP member, they would have a monthly contribution or a power account contribution or PAC payment you may hear, and it would be between $1 and $20. And again, that's based on their income. So based on the amount that they make, the state will determine how much they would have to pay. So it could be $5 a month or $10 a month, and that would be all that they would have out of pocket. They wouldn't have to pay for sick visits or prescription copays and things like that if they're on the HIP Plus program. Now, and I should go back because there's 4 different levels to the HIP program. So you have HIP Basic, HIP Plus, and then HIP State Plan Basic, and then HIP State Plan Plus, and then HIP Maternity. And
Wow.
or I said 4, I meant 5. So basic, the basic is in I'm gonna say before the pandemic when HIP was normal per se. On HIP Basic, individuals would have a copay. So every time they had prescriptions, they would pay, I believe it was $4 to $8 for prescription copays. Or if they have a hospital stay that's non-emergency, they would have a copay that they would have to pay. So it's more expensive to be on the HIP Basic versus being on the HIP Plus, where you just make that one monthly contribution of $5 or $1. And that's all your out-of-pocket expenses. So, and then with the HIP State plans, that plan is for the medically frail individuals, so they have more enhanced services. Like I'm gonna use dental for example, and they have enhanced dental benefits, so they can get dentures. We're on the HIP Plus program, dentures is not a covered service. So those are like, depending on your needs and what you may qualify for, you may be put on the state plan or just on the regular HIP Plus plan.
Okay. That's a lot. And the HIP maternity, you said, what's that about?
Yeah, so HIP maternity is for individuals. So say a mom is on the HIP Plus program, she becomes pregnant. So she will be switched to the HIP maternity, so all her cost sharing would be turned off, so she wouldn't have to make her power account contribution every month because she's pregnant. And then once she's had her baby after 12 months, then she'll go back to her normal HIP Plus plan, whatever she was on. So if it was HIP Basic, she would have the opportunity to go to HIP Plus, and then, or if she may qualify now, maybe she's going has extra needs, she may qualify for the HIP State plan and go up to that. So that's how that works.
Now, let's just say mom goes to the hospital and she has a baby. Does the baby automatically have coverage when it's born too with this plan, or?
The baby would be covered. The mom's coverage will cover for the first 30 days. So during that time, that's the baby should be getting signed up. So that they can usually start that process in the hospital. And the mom can just talk to the social worker or financial counselor before she leaves to make sure they start that paperwork. So then once she gets the Social Security, she can get that all sent over, and the baby can get their own Medicaid ID.
And the baby will say the mom is with your organization, MDWise, and the mom signs up, the baby's automatically under MDWise too once the paperwork is completed, or would they be shifted somewhere else, or?
Normally, yeah, they'd be placed with the same provider as the mom, or if the mom chooses, she may have a preference. Maybe if the doctor that she wants the baby to go to doesn't accept MDWise, they may accept another plan. So yeah, but the mom does have the choice if she wants the child to go to MDWise like her or go to a different MC. It's totally up to her. But if not, then they'll auto assign them. But they usually auto assign them to the same plan, but it doesn't always work out that way. So if there's no preferred MCE on there, they'll just get auto assigned. So it may be the same play, it may be us, or it may be a different MCE.
Yeah. So if you get auto assigned and you say, I want to go back to MDWise, can I go back to you guys, or that auto assignment, does that just stay in effect? I'm sorry, this is what we got you.
So for like the HIP program, say you sign up and you don't want MDWise, but you want an Anthem. So as long as you don't make that first power payment, you could call the enrollment broker and switch before you make that first power account payment. But if you make that first power account payment, you have to stay with that same MCE for the whole year. And then in November, there's an open enrollment period. So starting November 1st through December 15th, that's when you'd have your chance to switch from one MCE to the other.
I see. Okay. All right. And Spencer, talking about the hospital, let me jump into this one. How does that process work when a person goes to the hospital without insurance? How do they get signed up for insurance? What happens to them?
Usually the hospital will sign them up for PE, which is presumptive eligibility. And then from there, the individual just have to finish their application. So because the hospital can only provide so much. So the member or the individual will have to go and create that portal account or go to the navigator at the hospital or a CAF navigator to finish up providing the rest of the information that's needed to complete their application. And then they'll be under presumptive eligibility, so they'll have some get some benefits, and then until their eligibility can be determined or is determined.
Now this presumptive eligibility, make sure I got that right. So that means they don't have to pay for that stay if once they sign up for presumptive good for a period of time?
Believe it's just for 30 days. And because it takes 30 days or so for Medicaid application to be processed. So that's how long the presumptive eligibility lasts.
Okay. So to be clear, that 30 days, you're covered for those 30 days, whether you get accepted or not. That time space was good.
Yeah, because you were in the hospital, and that helps with covering those hospital, especially if you go in the ER as an emergency. That covers, that helps pay for that stay. And then any service, you go through the application process, and then you'll be determined, and then coverage will start that following month. And then you can go to the doctor and get all those other services needed.
Okay. So the navigators, they're on site, possibly. They talk to the individual patient at that time, and then they'll guide them to make their own choice on what MCE they want if they're not auto.
Yeah, if they, but and they don't make the choice for them. It's the members or the individual's decision. So, and if they don't have a preference, then the state will just auto assign them if they leave that space blank.
Yeah. Okay. So the navigator probably educates the patient on the options or the different MCEs or the benefits.
And so the different MCEs will go around, and usually we'll meet with the navigators and make sure they have updated material. So when they are speaking to individuals at that time, they'll be able to say, if the individual says, well, I don't know who are these, what are my choices? Well, then they'll have that information to give to them, where the member can make that informed decision based on the information they read.
Nice. You had mentioned individual with disabilities as well. The navigators can cover all that too. Let them know you may be eligible for this program. You said like the HIP State Plus. That's for disabled people. You said for people with disabilities.
Frail. So in order for an individual to be determined medically frail, they would have to contact their MCE, and that MCE would have to do a medically frail assessment. And based on that assessment, will determine if they're medically frail. And then that's when, so if they're determined, you're medically frail based off of that assessment, then that's how they get bumped up. But if they aren't, if they're based off that assessment, if they aren't deemed medically frail, then they can't get on the HIP state plan.
Okay, that makes sense. You had mentioned earlier about those copays. If a person has a copay and say some unfortunate reason he doesn't make his or her copay, is there a penalty for that?
So if they, and it's been so long since the copays are on, I'm still like,
okay.
But they have like 30 days to make their payment. So if they're behind, they have a period of time that they can get caught back up. And also too, with, like, for instance, for MDYs, we have our rewards program where if they're going to the doctor, well, and getting their annual physical done, going to the dentist and
Mhm.
getting their checkup done, if they complete their health needs assessment, they can utilize their points, which turns into dollars, or for gift cards. So like $10, $25, $50 gift cards, they can use, instead of getting gift cards, they can use those points to go towards their power account. So that could help
Hmm.
too. Say they don't have that $5, but they have that 10 points in their account. They can use some of that to go towards their power account for them.
Wow. That's a good man. That's almost making it too easy for you there. Um, I, I know Medicaid covers a lot for individuals, but I don't think they cover certain things such as adult diapers or maybe Botox or something like that. Can I get that? Can
Oh,
I get some constructive
yeah, you can
surgery?
get
Can facelift?
cosmetic surgery or things like optional, like it's not a needed service. You can't just
So,
go like, um, yeah,
so I
like
can't get this. I can't get that facelift if I want it. I can't. You can't get
no, you
that.
can't get facelift or um,
No.
augmentations
This.
or things like that. Medicaid does not cover
Okay.
braces. Medicaid doesn't cover that, or
What? They don't cover braces?
that's
That's a, well, I guess that's not needed. I guess. Well,
yeah. It's not a. It's
okay.
not a. It's not part of. It's just. It's visual. It's not like
Is that
it's a.
vanity? Okay. All right.
Yes, vanity. It's not
Okay.
affecting someone's health. Now, if they
Hmm.
got in a car accident and they, that's a
Okay.
different thing. But if
Oh, that
it's
makes
just,
sense. Yeah.
yeah.
Okay. So if they pull a Kanye West, y'all got him. But other than that, you on your own.
Even then, that's
Okay.
a whole nother process. Yeah, that's probably a whole nother PA process, prior authorization. Yeah, a whole nother
Okay.
thing. Out of
Okay.
my,
Yeah. I'm glad you brought that up. That prior authorization. That members really don't have to do that too much, do they? With Medicaid.
no, that's the doctor, because the doctor has to request that type of stuff. So prior authorizations would be done between the doctor's office and the health insurance company. The member
Okay.
doesn't have any process or have any um, play in that part.
Yeah. Now, I have a question. You may not know the answer to this, and that's okay if you don't. I was just wondering if a person has Medicaid in Indiana, he travels to Chicago for the weekend, gets in a situation, hurts himself. Is his Medicaid good in Illinois as well? Or does he got to drag himself back to Indiana to get help?
It would. I don't know the exact process, but it is possible. It's just, again, different procedures that would have to happen
Yeah,
in order
yeah.
for that to be covered. But normally, no, Indiana Medicaid only covers in Indiana, unless for an
Okay,
emergency, and that's a whole nother process. That,
right.
yeah.
Okay. Yeah, yeah. I was just wondering. I mean, hopefully that doesn't happen, but I was just thinking,
Mhm.
you said you cover Indiana only. So obviously, COVID affected the way you guys did business as a company during that time. What, how surprised were you at the changes you guys were able to make during that time? Would you guys just panic? Did you just know we got something in place, have a contingency plan, or how did you come up with so fast to keep it moving? Because 400,000 members is a lot of people.
Yeah, I wasn't part of that,
Okay.
decision of work, or if we're gonna work from home or not. But I know, like everybody, we all had to pivot and still got the work, got it, had to get it
Yeah.
done. So just had to
Yeah.
pivot from working in the office to working at home, which really you
Hmm.
all doing the same thing. Except,
Right.
my part, I'm used to being out in the community and
Hmm.
going to community events and going to different places and facilities and agencies and participating in things, being around people. And during the pandemic, nobody could get together. Everything turned to virtual. So it was just readjusting how
Right.
we did.
Yeah. 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 I think the virtual world was good. I mean, I think I'm an introvert. I thought it was great for me, just to do something different. And, it's just, I don't know. Didn't like losing that mileage on that mileage on money. But
My,
yeah.
our head, but I use our van, our van. So I know I try not to use my car if I'm going like long, like
Yeah.
more than 3 hours, more than 2 hours. I
Mm-hmm.
I don't use my car anymore like I used to.
Okay.
That's when I first got my Mazda. I was putting miles on that, but
Let's
and
slow it back, man.
yeah, it was like in the last few years, like why am I not using the van? Why am I putting all these miles on my car? So I've been
Mm-hmm.
using our vehicles more than my own
Yeah,
personal car.
that's a good way. My next question is, are individuals resistant to getting insurance? Uh, is there any reason somebody's like, yeah, I don't know if I really want to do it? Are they really fight that, or just all, I'm gung
No,
ho, let's do it?
some people it's just whether it's a priority or not. Some people feel like they don't need it. Just that everyone's different, but most of the time, if somebody has the opportunity to get it, they're gonna get it. It's just as long as there's not so many barriers for them to get it.
Right. Yeah.
Most people
Yeah.
are gonna, I think, get it or get it
Yeah.
when they need it. But
Yeah.
yeah.
I was curious to know because I'm not sure if this is the marketplace or still Medicaid. I hear the term Obamacare thrown around a lot. What is
Oh yeah,
Obamacare? Is that a
that's
real
the
thing?
that's the
Okay.
marketplace, the Affordable
Okay.
Care Act, and that's still around. But there's only two plans, I believe, in Indiana, and that's Care Source and MHS, which is Ambetter, I believe, had the
Okay. Yeah.
plan.
People start to get okay. So that is a real thing. Okay. So
Mhm.
it looks like you guys are very active in the community with all the things you said. Can you share any success stories of your members? You have any of those that you can share with us without saying a member name? Is there
Oh,
something that
um,
needs help anyone?
be on the
Some
side.
member like you? Okay, we come back to it again. Think of one offhand. I just know that with all those great perks you mentioned, I was like, man, that would make
I
me want to
use
just get up and,
example.
oh no,
I was at an event the other day, and just
housing.
it's just
Uh,
general individuals they say they have our coverage. They always say they don't ever have any issues, or they like our coverage. They're able to get what they need done. They haven't had any problems, or um, they like the
yeah.
rewards program when they know about the rewards. Or I was at a treatment
Mm-hmm.
center on Friday and spoke to someone who was like, "Yeah, I like MDYs. They've never had any issues, or and coverage great." And so I usually those are the type of feedback I hear. Or um, a long time ago, I heard MDY saved their life, or because they got in a car
Ooh.
accident, was able to get health coverage, and the HIP program helped cover all that their
Mm-hmm.
hospital or their doctor visits and things. So those are the general
Yeah.
customer experience
That's
that I
good.
hear, at least.
Yep.
Don't hear any too, I don't know. I'm sure there's members who aren't satisfied, um, that may say to another
Oh
plan,
yeah.
oh,
People bitch about it.
yeah.
Mm-hmm.
But
Yeah,
overall, I
you
hear,
don't get that. That's good. Again, you're listening to What's Up Award, the podcast featuring Rachel Maxey. We're talking about Indiana Medicaid. And we're going to pivot to the second part of the show because we're about to wrap it up. But this is the rapid fire, getting to know you questions. We're just going to ask you a few quick questions. You just tell us the first thing that comes to mind, and we'll go from there. First question is, what is something that most people are surprised when they find out about Rachel? Any secrets? Anybody look like you? Anything?
I do have a twin sister, an identical twin sister, which is
Oh
a
my
funny
goodness.
story. I'm in school, and one of my the guys who was in my class, he was at Walmart and was thought it was me, and it was actually my sister. He was just talking to her like, "Hey," she was looking at him like, "I don't know you." Like, that has happened. This happened before
Well,
too, but that was
man,
that happened like recently.
yeah, that's cool. You got a twin. Do y'all work both at NDYs together or no?
No, she works at a travel or a timeshare company, RCI.
Okay. Do y'all ever switch roles just for fun? You do
No,
her job for a day, you
there's
do
no
yours?
way.
Okay,
No,
all
there is no way I could
right.
do her job. There is no way she could do mine. She knows
Okay.
nothing about Medicaid, so we we don't know
Yeah.
we don't know how to do each other's jobs. So there's no way we'd be able to get
Okay.
away with it. would be
Yeah.
given away or be caught.
Okay. Next question. Let's say something happened and Rachel had to go to jail. They gave you two options. Number one, you can go in for 1 year, go in January 1st, come out December 31st, or they give you a Rubik's Cube mixed up and say, as soon as you solve this, you can leave. Which one are you picking?
I do the Rubik's Cube.
Really? Have you ever solved the Rubik's Cube before?
No, but
You, you,
I,
you can't
I
leave until it's done.
I figure it out real quick. Shoot, it might take me
Okay.
about that year. So
That's what I'm saying. And look, it may be 10 years if you can't. Okay. Ooh, why so?
true.
Ooh, okay, cool. All right. What is
But
your
what
love
if it was
language?
4 months?
Yeah, that'd be cool.
A year.
If you can get out, yeah, but I don't trust myself. No, because no. Yeah. All right. Yeah, I gave my question. What is your love language? Words of affirmation, physical touch, gifts, acts of service, or quality time?
Mm,
Hmm. Words of affirmation, physical touch, gifts, acts of service, or quality time.
acts of service.
Okay, I think I like that one too. That's a good one. I don't think people can be pigeonholed to one. Some people might like all of them.
Yeah.
I think I probably like all. Okay, next
Me
question.
too.
Who is Rachel? who is Rachel's celebrity crush?
I don't have one
Mm,
per se.
you don't like no celebrity. Okay, cool.
Michael B.
I
Jordan, I
don't
guess.
either. I ain't
That's
mad at
the
you.
most
I,
recent.
I thought you would say him if it's gonna be him. Okay. You don't like the other dude, Poppy? What's the other dude? Northwood,
Uh,
Anthony, whatever, the dude in Creed,
his, I
whatever
know
his
who you're
name
talking
is.
about.
Yeah,
He plays in the
yeah,
Marvel
people
movies
like,
now too.
what he
That
doing?
was
Man,
his
he's doing
name.
everything. I can't
Jonathan
even.
Majors.
Yes, yes.
That's
You like him
yeah.
too?
Yeah, I like. He's a good
Okay.
actor. I really like. The first time I saw him was in what was that show that came on HBO? It was like the black
Uh,
horror
oh shoot, I
genre.
don't know. I don't even,
I used to
the
talk about it all.
blacks,
No,
night Tales from the Hood, I don't know. I can't think of it. Uh, we'll circle back to it.
yeah,
Uh,
you know, I have to look it up though because it's gonna be on my
yeah.
mind.
What
Oh,
type of music do you listen to?
Lovecraft Country. That's what it was.
Yeah, you did tell me. Okay, yep, I remember. Yeah, you told me that.
Yeah,
Isn't there a
with
Smud in
Journey.
there too?
Yeah,
Yes. Yeah,
uh,
yeah. You told
Journey
me about that. Yeah. Okay. Okay. Let me see. What's my next question? You made me lose my thought. What type of music do you listen to when you ride in that van or coming into work? What's on her playlist?
it depends. So if I'm just riding or just doing an errand, it's just R&B or whatever. But if I'm going to an event or like a long drive, I'm
Hmm.
listening to ratchet music. Like, get you
Okay.
up
Get you right. Okay.
like, get ready to get energy to
Yeah.
talk.
Get yourself hyped. Yeah,
Yeah.
I understand. Uh, this question has three answers. Everybody in their life tend to have three people: a person that they try to mentor or help. They have a person who's their equal or their friend, and they have a person who they look up to. Who is somebody that you mentor, and who's somebody you vent with, and who's somebody that you look up to?
Mm,
Or maybe you don't mentor anybody. You don't have to.
I don't mentor anybody. Yeah, no. I mean, I give
I thought you would
advice,
say
I guess.
Kennedy.
Huh?
Yeah, I thought you'd
Oh,
say Kennedy.
no.
Okay.
She just, yeah, a wild child. Don't
Mhm.
mentor her.
That's her
Somebody
niece.
I look
That's her
up
niece for
to.
those out there listening. Yeah,
I
so somebody you're
said,
equal. Somebody who's your homie, your girl that you
oh,
talk
my
to.
sister. That's who I vent to for about
Your sister.
everything. Yeah.
Good, good. And is there anybody who's been like a mentor to you?
Um, Nikki, she is kind of a mentor to me. I feel like
Yeah.
it's a
Okay.
lot
Former
things that
supervisor.
I
Yep.
yeah, kind of, learn from her and
Yeah.
yeah. I would say, and we still
Okay,
talk and stuff. So I would say I look to
good,
her. As a
good.
mentor.
Yeah, yeah. You're a fairly independent person too. You're very smart, so I can understand that. Next question: who is your favorite sibling?
My sister.
Who most people avoid. You just went there. You just extra brother out. Okay, all right.
I'm
Oh,
not that close to my brother though. That's why.
okay, okay. I understand. I understand. Last question in this round is: what's something that you think everybody should do at least once in their lifetime?
Travel overseas. That's what I plan.
Mm,
Yeah.
okay, so you plan on doing that too? I know you
Yeah.
cruise a lot, so you've been out the country. Yeah.
Yeah.
Okay.
But I want to like go further, like to Europe or Morocco, or I definitely
Ooh,
want to go to Morocco to the desert and ride camels and dirt bike and all
yeah.
that stuff I've been seeing people go. Or
Mm-hmm. Nice, isn't it?
yeah, just someplace different other than like always going to the tropical islands or whatever on a cruise. I want to like fly to a destination too.
Yeah, that does sound nice. I
Actual,
would like to do that too.
okay.
Is that something you might do this year?
Probably not because I'm finishing school, but definitely in the next 2 years because I was actually really thinking about it. Still need to get my passport, but definitely, yeah, in the next 2 years, I want to go fly somewhere.
Okay. All right.
I
Yeah, I
choose
think
where.
I might look into that too. Now you got me thinking about it. I may do that. I'm gonna look into it. That does sound nice. Well, Rachel, it's been a pleasing pleasure to hear your story today and talk to us all about the fascinating world of Medicaid. Is there anything you want to correct, change, or modify before I get my final thoughts?
No, just everyone. If you're in Indiana, check have in your friends or family members are receiving Medicaid. Make sure they check their coverage. Make sure they have their updated address, contact information, all that good stuff. Um, with the state, so they don't miss any important mailings and um, end up losing their coverage, unfortunately. So I
Yeah,
encourage everyone to
yeah,
check your
absolutely.
coverage.
Hmm. And where can people find out more about MDYs or a contact number?
You can check out our website at mdwise.org, or if you're a member or just have any questions and like to call and get those questions answered, you can call our customer service at 1-800-356-1204.
Okay. And what's your website again?
mdwise.org.
mdys.org. Okay. All right. Well, I'm going to go ahead and give my closing remarks before we get out of here. I will say again, thank you so much for joining us. Again, today we learned so much about insurance thanks to our guest, Rachel Maxey. We also realized that when we shine light on people doing positive things and have a story to share with them, we all learn. If we can get someone to open their mouth, then we can get them to open their mind as well. Indiana has a great insurance company, MDYs, and we just learned about that. So keep this in mind as you go on with your day. Everybody has a story to tell. We just want to know yours. Until next time, peace.